Black Death was prevalent, a world ruled by bacteria, a world without antibiotics. Bacteria are single-celled microorganisms that are capable of wreaking havoc on an individual's immune system. Although not all bacteria are harmful, some actually live in and on the human body, assisting with daily bodily functions. Antibiotics are powerful medication that can stop the growth of bacteria or kill them without harming or impacting the host system in any sort of way, which is wonderful for us. We went out and asked people what they thought about bacteria and antibiotics, and here's what they had to say. So can you tell me what antibiotics are?
Antibiotics kill bacteria.
Do you know what bacteria are?
Bacteria are tiny little organisms.
Do you know what antibiotic resistance is?
Yes. Do you want them to answer another question?
I would like... So, can you tell me what bacteria are?
Microbes that cause disease, infection, they feed on plant and animal life, I guess, decomposing.
Can you tell me what antibiotics are?
Drugs that fight infection.
Okay. Can you tell me what antibiotic resistance is?
Yes, where you take antibiotics too much and then you develop diseases, develop resistances to the antibiotics, and then the antibiotics are no longer effective.
Do you know what bacteria are?
They're like the little circular things with like the little things that go up and like they're inside you, right?
Do you know what antibiotics are?
They're like the things that go inside you to like kill off the bacteria or like viruses. I think so. Is that they're like also little circle things?
Do you know what antibiotic resistance is?
Is that like the resistance towards antibiotics? Yes.
So antibiotic resistance originates in mutations, a screw-up in the replication of the bacterial DNA. Replication is a process of how bacteria multiply from a singular bacterium to thousands of bacteria. So relating back to antibiotic resistance, when someone taking antibiotics doesn't finish their treatment, the bacteria that aren't killed are left to replicate with their mutations because they survived in the environment. This will enable future generations of bacteria to survive in antibiotics.
It's been suggested that clinicians are actually often prescribing these antibiotics whenever they actually don't need them. So you mentioned that earlier.
Right.
As a physician, have you witnessed this, whether in your own practice or in others?
Yes. That's actually one of the biggest struggles that I think I face here working a lot. People come in here and they either come and seek medical attention the first day that they develop symptoms of a runny nose, and they expect to be handed a prescription of an antibiotic, and technically you can't determine whether something's a virus or a bacteria based off of one day of symptoms. A lot of people, for instance, with sinus infections think that, if they're having green colored mucus drainage from the nose, that's bacterial sinus infection. Well, no, that's actually not true. It's actually the length of time that they're having the symptoms that determines virus versus bacteria. And so a lot of people get annoyed and upset because they either A, don't want to have to deal with the symptoms for as long, or B, they just want the antibiotic. They want the quick fix. Everybody now just wants the quick fix. They want the shot or the medicine that's going to take it away. Nobody wants to wait the few days, and that's the biggest struggle. I try my best to explain there is no quick fix in medicine, and whether that makes people upset or not, you kind of have to decide if you want to be doing the right thing for the patient or making that person upset, and that's where you will find the difference in providers.
as a clinician, what are your suggestions for preventing or stunning, or at least stunning the growth of these drug-resistant bacteria?
I think that the best thing that can be done is just trying to do your best to not overprescribe antibiotics when you don't have to. And, you know, that's speaking very generally. I know that there are certain situations when sometimes you're not, it's going to be a lot easier to just hand out a prescription than to sit there and fight with the patient. And in that situation, you know, you're going to have to take, that's going to be a situation by situation, game time decision. But education is the biggest thing. And a lot of times I think that that is where providers lack, because now this field of medicine has been turned into such a business anymore. You are supposed to see as many patients a day as possible, and you're running on the clock, so the amount of time that you actually spend with a patient is minimal. And I think that if you can spend an extra 2 minutes explaining your reasoning for things and educating the patient, then they may be okay with not getting the antibiotic. But simply just telling them you're not giving them one because they don't need it, that's not going to cut it. So education mixed with not giving it, you may see better results than just simply saying no and doing that.
All right. Well, thank you for your time.
No problem.
Most of the scientists that are trying to find new ways to kill bacteria are undergraduate and graduate level students who are doing work for free or for the university that they are at. The idea of the research started off with a professor who has a PhD, an MD, or even an MD PhD, and they want to find more information about bacteria. This professor gathers students to help him assist him or her in the research. There are some scientists that are doing work outside of universities, but for the most part, the research is being conducted in the universities. Do you know what antibiotics are?
Are they like little people inside like capsules that go inside you, and then they use like a flamethrower to like kill the bacteria? Because I mean, when I take them, I feel like really warm sometimes. I even sweat. So is that how they do it? Is that what it is?